So we are joined today by Juliet, who is a OCD therapist with a private practice. And real quick, in as short as you can, please answer the following questions as quickly as possible, while still giving the full answer. When does therapy not work?
I feel like I'm on the hot seat. This is a good question. Therapy doesn't work for a couple of reasons. One is it's not a good fit. So the therapist and the client maybe have different approaches or have different styles that just don't work well together. Therapy also sometimes doesn't work if a person isn't in a place to do therapy. So either financially or physically, if they're doing teletherapy, but they don't have a private space in their home to meet, or if they're just mentally not ready to do therapy. And then for OCD in particular, therapy doesn't always work if the therapist isn't trained in OCD. So the therapist might unintentionally reinforce the OCD or do things that end up fueling a person's intrusive thoughts and obsessions and compulsions.
What's the number one reason why people delay their recovery?
A lot of times it can be fear of sharing what they're thinking about and worrying about, because a lot of times with OCD, we are so distressed and afraid of these intrusive thoughts that the idea of reaching out to a mental health professional or a psychiatrist and saying, hey, I'm having these really distressing thoughts about killing my dog, or hey, I'm having these really distressing thoughts that I could secretly be a pedophile. Those are really scary things to think about, especially when you don't know it's OCD, to then talk to someone outside of you, because you might worry you'll be judged or you will get in trouble or that something bad will happen.
What's the biggest OCD lie people tell themselves?
That this time it's different. So with OCD, a lot of times, whatever the current kind of intrusive thought or obsession is, it always feels like this time is the exception. So it's I have OCD, only the thing I'm worrying about right now is real. Everything else was just OCD, but this specific thing is serious and real. So I better just, do the compulsions just in case.
What should OCD recovery feel like?
It should feel difficult, but empowering.
What's a clear sign that my ERP is actually working?
My world is getting bigger instead of smaller. And I'm learning that I am more courageous and I'm stronger than what my OCD and anxiety tells me.
What's one hard truth every OCD'er should hear?
You're not in control. Bad things happen to people all the time. And even if you do every single one of your compulsions perfectly, the bad thing still could happen.
So some questions from the audience, right? So what does evidence-based OCD therapy actually look like from a week-to-week perspective?
When I think about evidence-based practice with therapy for OCD, the main kind of components of it, I would say, would be you are working with your therapist to, intentionally decrease the compulsions and the avoidance behaviors that you're engaging in. So that could look like keeping track of all of your compulsions through some kind of monitoring, and then systematically starting with one compulsion. And it's okay, for the next week, let's have you try and delay this as much as possible. If you can't delay it, how can we have you do it partially? So for example, if a person feels that they have to repeatedly check their door before they leave the house, how could we have you check your door again because you feel like you have to, but while you're checking it again, maybe you're looking at your phone so you're not fully engaged, or maybe do it until it feels 80% right instead of 100% right. OCD therapy also looks like intentionally doing things that will make you anxious for the opportunity to resist compulsions, but also for the opportunity to show yourself that you can tolerate being anxious and you don't have to do your compulsions in order to prevent something bad from happening. So in a really short summary, ERP or exposure response prevention therapy, which is the type of OCD treatment that I primarily use, it feels hard, but it feels empowering and it feels hard but manageable. So it's difficult, but you don't feel like you're just thrown into the deep end and you're not consenting to what you're doing. I'll throw you in, but you say, okay, you can throw me in, and then I'll throw you in.
Yeah, I remember when I had ERP, and to be honest, it was one of the hardest things I ever did in my life. And it's super hard, right? And my therapist would always push me a bit, and it would always be a bit sadistic in some kind of a weird way, right? And I came home with all these stories and how awful it was, but still did it. And she was like, okay, but now we're going to do one step more. And I was like, when does this ever end? But it is really empowering went, after a couple of months, I would say. Not in the beginning, it's super scary, but definitely one of the best things I ever did in hindsight. And when you're doing ERP right, how should it feel? Should it feel good? Because when I started, I had this problem of thinking, okay, I go to therapy and I will talk about my problems and I will just feel da-di-da-di-da, I will get better. But this wasn't the case with OCD. So how should one feel when they have ERP therapy? Should it be easy? Should it be relieving? Does it give relief, or what's it like?
So a lot of times people come to me for therapy and they're like, my goal is to like not be anxious, or my goal is to feel better and like not have intrusive thoughts. And I right away will say, hey, that's not the goal of this kind of therapy. The goal of this therapy is to help you learn that you can tolerate anxiety, and that even if you have intrusive thoughts, you don't have to like give those thoughts a ton of energy and a ton of attention. So a lot of times that feels icky to hear because people want to feel better in terms of like, I never want to have a scary thought again, or I never want to feel anxious. So initially, usually exposure response prevention therapy feels like really hard. A lot of times people say that they're more anxious, that their OCD is like freaking out, because that's kind of the point. Like, we're intentionally kind of trying to poke the bear to help you learn that you don't have to respond the way you've been responding for the last months or years since OCD showed up. So ERP usually feels hard at first, and it's hard kind of the whole time, but the more experiences you have where you like face a fear and you do a difficult exposure and then the bad thing doesn't happen, that is like more reinforcement of how this works. And then people end up getting more creative and more empowered. And then it can actually be like difficult, but kind of a fun challenge. It's like, ooh, I never thought I could do that, but I just did that. So that's what I would say. What are your thoughts on it?
Yeah, totally. I mean, I can attest to that. So when I was in my worst spot, I couldn't leave a certain chair in the house. So I would stay on that chair all day long for months on end.
Oh, man, that must have sucked.
That was really sucky. Yeah, I won't lie.
Yeah.
So not really had any life there. But then my therapist took me outside of the room, and then slowly we went into real life, and slowly I could do all these things again, which I forgot that I could even do them, right? And it was really empowering. But yeah, during that time, I was always afraid that I would make mistakes. I would always want to make it perfect. So, but what are some things some common mistakes people make when going to therapy, that they should know about?
One thing I often see with clients who have OCD is they're often really like very motivated and very high achieving people. And it's like they would love to just like do the whole treatment model in like 3 weeks. Like, let me just, sprint through this, just do everything, rip the Band-Aid off, and then I'll be good. And we talk about like, this is a long journey. We cannot sprint through the steps. Like, you're going to have setbacks. You're going to have times when it feels hard. And it's really important to like stick through it, even when you aren't seeing the results you want, like immediately, because it does take time. And we're aiming for progress over perfection. So even if you can like decrease your compulsions by like 3%, like that's still 3%. And even though that doesn't feel like a lot in the beginning, after, you add up a bunch of 3%, I'm no math whiz, but that's more than 3%. So, it's like each time you do something and it's a win, it's like getting a penny. And, a penny alone is not a lot of money, or I don't know what currency a penny would be equal to, but it's like very small. But after like 3,000 pennies, you have some dollars, and that's a lot of money.
Buy maybe not from that, right? Yeah.
Yes, you could buy coffee. I don't know, with inflation, it might not be as much, but the point is like small things add up.
Yes, I agree. And I agree with what you said with the recovery, right? So when people DM me, it's always like, oh, you've went over this and it looks almost perfect, right? But I've had so many relapses, I can't even count them. It's just a part of progress. And I'm curious, I get a lot of DMs that ERP doesn't work for them because it makes them more afraid, and it makes them it gives them more discomfort. And is there truth in that, or are they just maybe afraid to do these ERP sessions?
Well, it's hard to speak like for these people, but what I do often see is like if a person is doing exposures, so they're intentionally doing things that make them anxious, and then they're immediately doing compulsions afterwards, and they're like not decreasing compulsions, then they are probably going to feel more anxious and they're not going to feel better. So like I think with ERP, a lot of times the idea of doing really like creative and intense exposures it's like kind of romantic, right? It's like we like that idea. It's like that's the whole like I'm an ERP therapist, like I make people like eat things off the floor, like that's the fun stuff.
Yeah.
But what really is kind of like the main driver of change, at least from what I've seen, is like helping people decrease their compulsions. Because if you decrease your compulsions, you're going to be doing exposures all the time, like just leaving your house and just being out in the world. So for those people who feel like ERP isn't working, maybe exploring like, are there still compulsions that I'm doing that are kind of like offsetting the benefit of doing these exposures? And if so, pull back on exposures and just try and reduce compulsions and really get good at that before adding like additional stressors.
And I remember when I was first thought that I had OCD, I thought, okay, well, but I don't have any physical compulsions, right? What are you talking about? Everything happened on the inside. Is it something you see a lot in your practice, that people don't really have outward compulsions and they feel that they don't really do anything, but inside maybe they're ruminating or doing other compulsions? Can you explain a bit about that?
Yeah, a lot of times for people, the physical compulsions that they share are like pretty minuscule compared to like ruminating, mental review, body scanning, self-reassurance, saying something in your head or kind of planning for the future in a really like repetitive way. And a lot of times people say like, well, I can't control what my brain is doing. Like it would be easier if I just, couldn't touch something, or if I could like physically sit on my hands, because then I could stop. Versus the mental stuff often feels like super out of your control. And it does take a lot of practice to like identify when you're engaging in sort of like a compulsive thinking, and then how to like actively drop the rope. Like it takes practice. And that's why working with like a therapist who works with OCD frequently is really helpful, because they will have lots of ideas on like ways that can help you.
Can you share more about what drop the rope means?
Yeah. So when we think about OCD and when we think about like the what ifs and the cycle, we're kind of engaging in like a tug of war. We're like, we are holding the rope and we're like, but what about this? And like, I know I checked the door. And then OCD is like, but what if you had a false memory and you actually didn't check the door? And then you think, well, let me review my memory. And then OCD pulls back with like, but how can we trust your memory? And it's like this never ending back and forth. And the more we kind of come at OCD with like logic or really any kind of response or with fear or with like any kind of compulsion, we're just kind of giving OCD something else that it can like say, but what about this? So instead we want to imagine like, we'll never solve this problem. Instead of going back and forth, we just like imagine like, I'm dropping the rope. It's not relevant. I'm not giving this more time. Or like you can think of it like you're solving a really complex math problem and you're spending hours going over it. And eventually you realize like, I'm not going to get the answer that I want. So I'm going to just like drop the pen and walk out of the room. And I'm not going to try and solve that anymore. And with a lot of mental compulsions, it's a lot of that like solving something that can't actually be solved because there's no definitive answer that we want.
Makes sense. I always, compare it to a mosquito bite. Maybe that's a weird explanation, but trying to itch it and then it feels good in the beginning, right? But then it becomes worse and worse and worse. And then of course you have a bleeding, gaping hole that just won't heal. So that's how my OCD felt a lot of the times when I was facing it. And maybe that's good to answer, right? Because I had a lot of relapses and I felt hopeless many, many times. And I felt that I was back at square one or even worse in my therapy. So how do you help clients who feel hopeless after a couple of weeks of therapy, for example, when the spike becomes higher because of all the exposures, right? And how do you help those clients during those hard periods of times?
I think it's really important to have compassion for ourselves throughout all of it. Because like, of course, there are going to be times when it feels like we're making progress. And then there are going to be times when it feels like we're kind of set back. One thing I often encourage clients to think about is like, even if you do have like a setback, you're never going to be where you were before you started therapy, because now you know what OCD is. Even if you don't catch it right away, like you know so much more than you did then. So even in a really hard setback, you're never moving backward. You're still moving forward. And each time we have a period where like OCD is more sticky and OCD is more kind of present, that's another great opportunity to learn of like, okay, how can I learn from this experience? How can this experience like uniquely help me help other people, or uniquely help me help myself in the future? And I mean, it also sucks though. Like it's understandable to be frustrated when you work really hard and then OCD comes back. But that's not a personal failing. That's just kind of like the nature of OCD. OCD is a pretty kind of chronic condition. Like you can achieve great recovery and have long periods where OCD is really quiet, but it is kind of like something that is, I don't believe that OCD can be like, there's no magic bullet of like, okay, you had OCD, now you don't. It's like, how do you live with it and how do you not let it impact you in a big way?
Makes sense. And for all the people listening, when I first heard this, I was scared. I was super scared. Like, oh my God, this is chronic. And just to, I don't want to give reassurance right now, but chronic doesn't have to feel constant, right? And it's all about active recovery with OCD and staying on top of things. If you have weekly or bi-weekly therapy sessions, but what do you do in the meantime where you don't have access to therapy and exposures just feel too scary? What are some things you can do? Or should I just push for exposures?
Good question. You can work each day to decrease your compulsions. And there are going to be some days where you feel like you're a rock star at that and it's really easy and you're killing it. There might be times when it's like, oh, it was all I could do to, postpone a compulsion by 30 seconds. But that's still 30 seconds that you didn't just immediately hand over to OCD. So starting with small things and really like working to take control where you can. And then also you can really try between therapy sessions to, you can cut that part out. You can also try between therapy sessions to like prioritize things that bring you joy and things that are important to you. And you can try and do things that maybe OCD tells you shouldn't do. Because that's reducing a compulsion too. Because if OCD tells you, oh, you should avoid going out because something bad could happen, you could try and go out even for like 15 minutes and just see what happens. So actively kind of doing the opposite of what OCD wants. And then you can talk to your therapist about like structured homework too. That might be helpful. Those are my general thoughts.
And what are some things you can do as a person, right, that is not therapy, but is still beneficial to OCD?
Yeah, I think if you're listening to this, you're already doing a lot of things right because you're trying to access like community resources and learn from other people who have OCD. So I would really encourage you continuing to do that. The International OCD Foundation or the IOCDF has some really great like free resources as well as like workbook recommendations and like meetups and support groups. And so that's a great option. You can also talk to like your primary care doctor about like possibility of trying some sort of medication that could help with your symptoms. The International OCD Foundation has a really great resource about different medications that are commonly used for OCD, as well as like the standard prescribed dosage of those medications. So you could even share that with your doctor, and they might be able to help you in that way. And then also I have a online OCD Patreon where we have like lived experience community and we do monthly meetups. And I'm sure like it sounds like you have a lot of things similarly of like you're creating this OCD community. So there's lots of ways you can access support. And by you, I mean Mourice. Maybe the person listening also has a Patreon or has a podcast, and then that's cool too.
And they can share it with me. They can say,
yeah.
And hopefully you also become, one of the speakers on OCD Talks. And so something that was really hard for me, right, is my therapist would always say, yeah, you can just sit with the feeling. What does it mean, sit with your OCD and not respond to it?
Good question. Well, one thought I'm having with this is the idea of like acceptance. So accepting that there is doubt and accepting that you are feeling anxious. So a lot of times when we have any kind of unpleasant sensation or emotion or thought, we work really hard as humans to like make ourselves feel better because that's how humans are designed to survive. But a lot of times when we run from things, it just kind of like makes them feel more scary. So instead, we want to just accept like, yep, I'm feeling anxious right now. I wish I wasn't, but I am. And instead of like urgently trying to make the anxiety go away, I'm going to just like say, okay, if you want to join me today, anxiety, that's fine. I'm going to, and then insert whatever you were going to do before you started to feel anxious. So sure, anxiety, you can come do laundry with me. Can't guarantee you'll have a lot of fun because who likes to do laundry? Or you can imagine it kind of like a guest that shows up uninvited, but you, for whatever reason, can't tell them to go away because maybe they're a family member or maybe they're like your boss or something. So they show up at your door. You could shut the door, but they're just going to keep knocking because like, no, I have to come in. So you can say, okay, come on in. Have a seat right here. I'm just doing some stuff. Like, I can't really entertain you a bunch, but you can, if you have to stay here, I'm going to acknowledge that you're here and then kind of continue doing what I'm doing.
How do you practice that, right? So if, for example, now I'm listening and I'm like, oh yeah, this is all super, super nice and dandy. I can tell myself all this stuff, but when these feelings come around, I cannot think straight. I just want to find relief and I'll find it dandy. How do I still overcome this, right? So
it's hard. It's a really hard thing because of course, if there is a way to have relief, that would be great. And I wish there was another option, but unfortunately, there's not. So for example, that could look like you're really worried about something. You really want to Google something to, get reassurance or to make your anxiety go away. So sitting with it could look like, instead of Googling this, I'm going to go give my friend a call because I value my friendships. And even though I'm going to feel anxious because I wish I could be Googling why this mole looks slightly different than the other mole, I'm going to talk to my friend on the phone and then make myself some dinner. And I'll probably feel really anxious while I'm doing it, but I'm still not going to be doing the Googling.
Makes sense. Yeah. And I think that's the hard part, right? So for anybody listening, this was also very hard for me, but it's all about postponing the compulsion, and your brain will start to learn with time that there's nothing to be afraid of in the first place. And I think that really captures what you were saying earlier, right? So you have to be super, super hard on yourself, maybe even to stick with it, but you also have to learn to be super compassionate, right? That this is really scary.
Yeah.
And this is something that is maybe sometimes hard for people to do, right? Because you have to feel brave, but also feel compassionate afterwards. And I think this is something I struggle with a lot. On that note, what are some signs that people become more resilient towards their OCD in therapy? Or isn't that really the goal?
Oh, yeah. I think one of the signs is when people are able to laugh at their OCD and use humor and kind of think of their OCD in a way that's a little bit less terrified. So you're having these intrusive thoughts, they're really scary, but instead of focusing on the fear, when my clients are it was so funny, can you believe it? I was thinking this, isn't that funny? And they're laughing about it. Or when people are able to tell their OCD to fuck off, or when people are able to say, yeah, I was really scared, I did it anyway, and then I had a great time, and then the thing I was worrying about, I forgot about it. Those are awesome moments to see in therapy. And I think they're even more awesome for clients because they're oh, this actually is working. I'm re-motivated to keep doing this because I'm starting to see the progress.
Makes sense. And maybe let's move towards the fact that some people don't have access to therapy, right? I was lucky enough to find a therapist, and you're not lucky enough to help people with therapy on your end. But if someone's stuck on a waitlist, for example, or can't afford therapy, what's the first thing they should do to not spiral more with their OCD?
Yeah, as I mentioned before, there's so many great resources that are available for free online. There's the OCD Foundation. Also, NoCD, they have an online community that's free to join. There's a posting place. I've heard a lot of people use it for reassurance. So just watch yourself with that if you end up doing that. There's also a lot of free support groups out there. The Foundation has resources. I know there are a couple that meet every other week or every week. And then also there's tons of OCD ERP workbooks that are kind of designed for people to use at their own pace. Also, if you're listening to this, that's a great resource, just learning from other people who have OCD. Instagram and TikTok have some cool folks on there making advocacy and educational content. What else? Yeah, those are my main. And then your doctor, if you wanted to explore medication, that could be a resource too in the time between starting therapy, or if you can't start therapy.
And maybe this is a controversial question, but is it possible to recover from OCD without a therapist?
So, yeah. The therapist isn't the magic bullet. The therapist is just kind of shining a light on some resources and saying, hey, here are some things that, could work for you. And then it's all about how motivated the person is and how willing they are to implement the steps. And for some people, that is really hard even when they're in therapy. And for some people, having a therapist gently push them is exactly what they need. And then for other people, kind of doing it at their own pace within their own timeline works too. So yeah, absolutely.
And how does such a path look like, right? So is it the workbooks we talked about, or is it the resources? If you would have no access to a therapist, right? And they're stuck in a situation, what would you do? Like step by step, maybe like a short overview.
I would start by working with myself to like explore what are all the things I'm doing that are probably compulsions. So like keep track for a couple days of like ask for reassurance, Googled, double checked that thing, avoided this thing, get a sense of what your compulsions are. And then on your own, just see like, are there any that you might want to try and like postpone or resist or kind of intentionally disrupt? Start with that. And from there, it's like a choose your own adventure. I would recommend using some sort of workbook. There's lots of great ERP workbooks that go through it kind of step by step. So using that. And then there are also like online courses that I know some folks have, like OCD recovery course. But I would just encourage you to be cautious of people who like say, oh, like buy my program and like be cured, or like buy my program and like it's going to go away. Like you want to be getting resources from folks who are ideally like licensed therapists or licensed psychologists. Like if you're getting a workbook, for example, or a course. I'm not saying that like OCD coaching isn't valuable, but starting with a book that's written by like an OCD expert. And then once you have a basis of like how the treatment works, then if you wanted to like do coaching or do something else, that would be an option too.
I agree. Yeah, there's a lot of horror stories out there about coaching and even people that have their own methods. Right? So be cautious about that. Just wanted to add that. There's a lot of cowboys out there.
Understandably, like when you're really struggling with OCD or any like physical or mental health condition, like of course you're going to be like, I want to get better. I want to like, you are more vulnerable to like being scammed because you're like, whatever helps, like I'll just do it. And that's where I think unfortunately some people come in by saying, oh, just like take this supplement or, you know, do this 5-step program and pay me this monthly fee and then you'll be better, and be leery of that. But that's why IOCDF, the International OCD Foundation, all of their workbooks have been like vetted. They've got great articles so you can learn more about OCD and kind of start with that. Yeah,
awesome. So I know that you have OCD yourself, and there's a bit of a controversial take out there, but is there a benefit to working with a therapist that has OCD?
It's a good question. And I think it just really depends on like the client, because I believe that like if a therapist has had training in OCD and has done, you know, all of the ERP or ICVT like trainings, if they're an OCD person, like they will definitely be able to support you. And there's not like a superpower that having OCD makes you like somehow a better therapist to treat OCD. It doesn't work like that. But I do think there can be a benefit of working with someone with OCD. Like if you're a client who is like really has a lot of shame around like your symptoms, or has a lot of like embarrassment around your symptoms of like, oh my gosh, like I can't believe like I had to do this as a compulsion. Like I feel so gross about that, or that feels so weird. Like sometimes it can feel easier to trust a therapist when, even if you don't know like anything about their OCD, there is this like unique experience of OCD that like you can read about it, but until you've like physically lived it, you're slightly detached from it. So for some people working with a therapist who has OCD, it's like, okay, it's nice to know that they like get it on some kind of very like personal level. But I don't think it's like necessarily a major importance of like, do you have OCD or not? Because lots of practitioners, like, it's not like we're saying, oh, are you a doctor who treats cancer? Like, do you have cancer? Or like, have you had cancer? Like, that would be so weird, you know?
Yeah, it makes sense.
So,
yeah, for me personally,
what do you think?
I mean, I like people that have had OCD, right? Because you don't really have to say anything. You can just tell some general stuff about your experience and people will get it on a deeper level and you feel that they get it, right? Yeah. It's a bit of a universal experience. So with everything going on in the world, I always like to say that, if you have mental illness struggles, you can always connect over that above anything else. And you'll feel, way more empathy, right? Towards that person. But I'm curious. So what kinds of OCD did you struggle with if you'd like to open up about that?
For myself, it's been quite a lot of whack-a-mole stuff, but the like core kind of like fear is always like losing control or like never ending distress or death. So lots of health stuff, lots of relationship stuff, lots of harm stuff, emetophobia, fear of vomiting, some like pedophilia OCD scattered in there, and then some like scrupulosity, religious stuff. But it all kind of goes back to like, what if I'm in perpetual distress forever? Or what if I die and then I'm in perpetual distress forever and I have no control? Like it's always kind of coming back to that.
And what are a couple of the hardest moments you faced while going through OCD? Is it something you want to share or maybe not?
I think one of the hardest experiences for me having OCD was actually like, I knew I had OCD for a very long, like I was diagnosed when I was in like 5th or 6th grade, but I still didn't really know much about OCD. So then when I was in my like early 20s, I had a really intense like OCD flare, but I didn't even know it was OCD, even though I was like in school to be a therapist and I had OCD and I was like I think the hardest thing was just like the way that it just felt so real. That's one of the reasons why I try and make a lot of like educational content on OCD, because I just like, if someone like me who has a lot of privilege and has a lot of like mental health knowledge could be like bamboozled by OCD, even though I had been diagnosed like 10 years earlier, like average person who is not a therapist or who is not already in treatment, like of course that's going to feel like 10 times scarier. So that's kind of a vague answer, but I feel like it can apply to a lot of my harder OCD moments as well as other people with their OCD.
Is this one of the reasons why you became a therapist in the first place?
No, not actually, because I wasn't wanting to do any like anxiety or OCD stuff. I wanted to work with kids and do like play therapy stuff. It wasn't like, oh, I want to help people, like people help. It was more like, I want to work with kids and I don't want to be a teacher or a nurse, so I'll be like a social worker. But it wasn't until like later on, I was like, oh, I remember learning about exposure therapy and being like, whoa, this is interesting. I feel like I can relate. And also that would be cool to do. But I was already planning on being a therapist at that time.
And if you look at your environment, right, your friends, family, when you told them you had OCD, how did they respond? And do you share that you have OCD with all people or just with people on Instagram and with your clients?
Well, at this point, I feel like I don't stop talking about OCD. So people are like, okay, we get it. Like OCD is a thing and it's not an adjective and you have it. I was really fortunate that the place I grew up in and the family I grew up in, a lot of them are like in the mental health field. So there wasn't a lot of like shame or like minimizing of my symptoms, which was really, really good. I think the hardest part for me has been like believing that I have OCD, like from an internal, like I think the people around me have been really supportive. And I think it's always me being like, but what if it's not? Like, what if I built a whole career and have this Instagram community and I, have all these things. And then what if I'm just using OCD as a means to gain fame. Like, and you can use that as, you could say, the bombshell. It all comes out. No, I'm joking. But like, so it's more of like the internal, like questioning and doubt versus like people have been pretty accepting.
And do you feel any stigma around your OCD when you talk about it or?
Mostly when I talk about the kind of aspects of OCD that are not as like commonly talked about, like intrusive thoughts and, like harm-related obsessions, there's often just like a lack of understanding of like what that is. So for me, I don't feel like it doesn't impact me because this is like my bread and butter. Like I do this for a living. I'm really used to talking to people who don't understand what OCD is, but I can have a lot of empathy for clients who are like in their own experience and struggling. And then they're being faced with people who are like, well, that's crazy. Why would you think that? Like maybe you want to do that. But for me, I'm like, okay, whatever. You don't know what you're talking about.
Makes sense. And I think sharing your story is really important, right? Because you have OCD and you're a therapist, I think that's a unique combination. But if people want to find more about you, right? For people listening, how can they learn more about you?
Yes. So I have an Instagram account and it is at OCD_therapist_Juliet. I also have an OCD Patreon community. So it's $99 a month and I make like longer videos and I have worksheets and there's a whole community there of folks who like share wins and share struggles. And we do monthly meetups. And it's a really cool group of people. And, it's not in any way like a replacement for therapy or medication. We don't kind of go into specific like therapy. I'm not working as a therapist in that group. It's more of like, here's a place where people can share resources and like empower each other to do hard things. And then I also have a podcast called Intrusive Plots. I am a co-host with a filmmaker and director named Peter Cannon, who, awesome guy. He made a movie called Exposure, which is it's like a psychological thriller, and the main character also has OCD. It's a really cool movie. And so we make podcast episodes like once a month where we'll review some sort of movie or TV show that has like an OCD depiction. And then we will assess it for like, is this accurate? Is this stigmatizing? Is this harmful? Is this educational? How did they do? And then we also assess it from like a film perspective, like, oh, that was a really weird camera shot and things like that. So if you like film and you like hearing about OCD, it's definitely not like, don't use it as your information of like what OCD is. Like, I'm sure there's lots of educational podcasts like this, OCD Talks. So this is much more of like it's just something fun to listen to when you're like doing your laundry. While you're anxious and you have anxiety with you, you can listen to us make silly jokes and talk about movies.
Awesome. Thanks so much for joining. Give Juliet a follow, look up Intrusive Plots, and I thank you so much for being a guest on the show.
Thank you so much. This was really fun. It was really nice to meet you.